Greetings, everyone. My name is Steven, and I extend a warm welcome to today's lecture, wherein we will start on an in depth exploration of your head and neck, gross, and microscopic anatomy. Our focus shall be directed towards describing the salient features in the head and neck, histology, and pathology. For the part 2 of this series, we are taking into the histology and pathology of the key structures that includes your tongue, your tonsils, the adenoids, your ear, your nose, the paranasal sinuses, your minor and major salivary glands, the pharynx, and the larynx. On your left is the posterior border of the mobile tongue, which consists of a V-shaped row of your circumvallate papilla in curved blue arrow. The dorsal tongue has numerous filiform papilla in bold black arrow and scattered fungiform papilla in white single arrow. On the right is the linear foliate papilla in single black arrow that are found on the posterior lateral tongue. Note also that the numerous filiform papilla in curved blue arrow on the dorsal tongue. The ventral tongue in bold white arrow is smooth and it lacks papilla. On your left is the bulk of the tongue parenchyma, which consists of a muscle bundles arranged in a 3D configuration to allow for maximal mobility and functionality. Varying amounts of mature adipose tissue in black single arrow are associated with the muscle bundles. The tongue is richly innervated in curved blue arrow and contains many blood vessels. That is in bold black arrow, repleting with vascular anastomosis. On the right is the interlacing striated muscle bundles in curved blue arrow that allow for such essential functions such as mastication, phonation, and swallowing, and etc. On your left is the dorsal tongue, which a dorsal tongue surface, which is carpeted with conical shape at around 2 to 3 millimeters long, filiform papilla in a single black arrow. In contrast to other papilla, the filiform papilla are heavily keratinized, that is, in curved black arrow, especially on the tips. Throughout the tongue, only a small amount of loose connective tissue in white bold arrow, which separates the mucosa from the underlying striated tongue muscle that is in curved blue arrow. Looking on your right is the tips of the filiform papilla, which are heavily keratinized in curved blue arrow. Again, the filiform papilla generally lock your taste buds. On your left is a bacterial colonization by the oral flora bacteria in curved blue arrow that can be seen to varying degrees in the keratin of your filiform papilla. With extensive bacterial colonization, the tongue can appear brown-black macroscopically. On your right is the fungiform papilla in a black bold arrow that are the second most numerous papilla and are irregularly distributed throughout the tongue. They are between the numerous filiform papilla in curved blue arrow. These are around 0.5 to 1.0 millimeter wide. They are dome-shaped and slightly taller than the filiform papilla. On your left is a fungiform papilla that have a thin epithelial surface with limited parakeratinization in curved blue arrow, and the underlying stroma rich in small blood vessels in black single arrow, making them looking red or pink grossly. Your connective tissue stroma has small nerves that innervate the rare taste buds that are found in some fungiform papilla. On your right is, unlike in some mammals, the foliate papilla in single black arrow are rudimentary in humans. Note also that a small amount of loose connective tissue is separating the mucosa from your striated muscle in curved blue arrow. On your left is the foliate papilla that can have rare taste buds and are lined by a thin stratified squamous epithelium with minimal parakeratinization in curved blue arrow. The connective tissue stroma, which contains many small blood vessels and nerves, is shown on your left. On your right is the dome-shaped circumvallate papilla in a bold black arrow that are surrounded by a circumferential furrow in a single black arrow and a circular mucosal ridge which is composed of the velum, which is in a curved blue arrow, lateral to the von Abner serous glands in a curved white arrow. They are emptying into the base of the furrow in a bold blue arrow and are thought to flush out its contents. On your left is a circumvallate papilla that have a connective tissue core which is rich in haphazardly arranged small nerves in bold black arrow. They innervate the numerous intraepithelial taste buds in curved blue arrow. Taste buds can also be seen in the velum in single black arrow. Papilla nerve tissue can be mistaken for neuromas. On your right are your taste buds. Taste buds are oval, clear staining structures in single black arrow. They are comprised of a crescent-shaped taste supporting in basal cells. A taste pore in curved blue arrow transmits tastes via receptors on the microvilli to the underlying neurites, that is in bold blue arrow. On your left is a salivary gland tissue which is present in the posterior portion of your tongue, and these consist mostly of mucous gland lobules embedded in a striated muscle. These lobules have a central salivary duct in a single black arrow. These drains to the ventral tongue. On your right is the von Ebner glands, which are serous glands located only below the circumvallate papilla. Their ducts will drain to the furrows to flush out its contents. Both serous and mucous glands in the tongue are intimately associated with nerves. On your left is a serous von Ebner glands in a curved white arrow that are draining into the furrow in a single blue arrow, separating the circumvallate papilla from its adjacent furrow. This is thought to flush out the furrow contents in order to allow for new tastes to be better discriminated. Squamous metaplasia of the salivary gland ducts in single black arrow can mimic squamous cell carcinoma on biopsy or at a frozen section. On your right is an ectopic tonsil tissue in curved white arrow that can be seen anterior to the sulcus terminalis and can mimic neoplasms or lesions clinically. On your left is the ventral tongue, which lacks papilla, giving it a smooth, glistening appearance macroscopically. Note that the small amount of loose connective tissue in bold blue arrow, which separates the mucosa from the tongue muscle in a curved black arrow. On your right is the ventral tongue, which is lined by a thin, non-keratinizing, stratified squamous mucosa that lacks the papilla seen throughout the dorsal tongue. Next, we move with the tonsils in the adenoids. These are the lymphoid aggregates, which are covered by your epithelium that from majority of the Waldeyer. We have three major tonsils: the palatine, the lingual, and the pharyngeal. The palatine tonsil is located in lateral oropharynx between your palatoglossal and your palatopharyngeal arches. Your lingual tonsil, which is also known as the base of your tongue, is covering the surface of posterior or the 1/3 of your tongue between your sulcus terminalis and your valleculae. Your pharyngeal tonsil is also known as the tonsil of Luschka or your adenoid tonsil, are pyramid-shaped mucosa-covered nodular tissue located in superior midline of your nasopharynx. On your left is the mucosal surface of the palatine tonsil, which is mainly smooth in curved black arrow with 15 to 20 surface invaginations in single black arrow. Tonsils are largest in childhood and gradually atrophy by the adulthood. On your right is the cut surface, which shows the surface invaginations, which corresponds to crypts in curved black arrow that extend deeply into the lymphoid stroma close to the underlying compressed connective tissue pseudocapsule in bold white arrow. On your left is a tonsillar crypts in curved blue arrow, which represents invaginations of the surface mucosa into the lymphoid stroma. Unlike lymph nodes, the tonsils will lack capsules, sinuses, and trabeculae, but to have connective tissue bands that extend to the surface, which is pointed in bold blue arrow. The stroma is mainly composed of lymphoid aggregates in single white arrow and interfollicular small lymphocytes found on your left. On your right is the surface epithelium, which is non-keratinizing stratified squamous mucosa in blue single arrow. They become a specialized lymphoepithelium in the crypt zones, which is in white single arrow. On your left is a crypt epithelium, which is distorted by infiltrating lymphocytes and plasma cells, which impart a reticular appearance. These squamous cells are predominantly basaloid, which is formed in curved blue arrow. The surface has a thin layer of differentiated keratinocytes in bold blue arrow. Although non-keratinizing, desquamated squamous cells often accumulate within the crypts, which is pointed in in black bold arrow. On your right is the lymphoepithelium, which consists of basaloid keratinocytes with infiltrating lymphocytes, shown you here, and plasma cells, which imparting a reticulated appearance. On your left is a CD3 immunohistochemical staining, which highlights interfollicular T cell rich zones, pointed in blue bold arrow in a normal tonsil. Note also the presence of scattered T cells within the lymphoepithelium, pointed in black single arrows. On your right is your CD20 immunohistochemical staining, which highlights B cell rich follicles, pointed in blue bold arrow in your normal tonsil. Many B cells are also present in the T cell rich interfollicular zones in your curved blue arrow. Note also the presence of more abundant B cells within the lymphoepithelium, pointed in black single arrow. On your left are tonsil crypts. They are blind ending and typically accumulate luminal debris such as desquamated keratin in curved blue arrow and aggregates of oral bacteria in curved black arrow. This is likely contributing to the development of chronic tonsillitis clinically. The inset demonstrates a sulfur granule composed of numerous actinomycotic organisms mixed with the other oral flora. On the right is the connective tissue pseudocapsule, which contains scattered small mucous glands in bold black arrow with ducts in single blue arrow draining to the surface. On your left is small nodules of ectopic cartilage in bold black arrow that may be seen in the tonsillar connective tissue pseudocapsule. These are often associated with mucous glands and likely represent second bronchial cleft developmental abnormalities. On your right is a lingual tonsil, which is on the base of your tongue, consisting of irregular nodular tissue in curved white arrow, corresponding to mucosa covered lymphoid tissue with surface invaginations. It is located posterior to the sulcus terminalis in single black arrow and anterior to the valleculae in bold blue arrow. On your left is a similar to the palatine tonsils, the lingual tonsillar crypts in white single arrow that represents invaginations of the surface mucosa into the lymphoid stroma. They are shorter than those seen in the palatine tonsil and often extend downward to underlying skeletal muscle and salivary glands in curved blue arrow. On your right is the surface epithelium, which is non-keratinizing stratified squamous mucosa in curved blue arrow, which becomes a specialized lymphoepithelium in the crypt zones in white single arrow. On your left is the lingual tonsil crypt epithelium, which is similar to that of the palatine tonsil. Basaloid keratinocytes in curved blue arrow are infiltrated by lymphocytes and plasma cells, which somehow distort the mucosa. The surface has a thin layer of differentiated keratinocytes in curved black arrow. Desquamated keratin debris can accumulate in the lumen in bold blue arrow. On the right is identical to the palatine tonsils, scattered small pure mucous glands with ducts in a single black arrow draining to the surface are seen in the connective tissue pseudocapsule. On your left, unlike other tonsils, the pharyngeal tonsil does not have true crypts, but instead has a variably elongated mucosal folds pointed in black single arrow. These are containing lymphoid tissue composed of follicles in curved blue arrow and interfollicular lymphocytes. On your right is a primary lymphoid follicles and their germinal centers in white bold arrow that are intimately associated with the nasopharyngeal surface mucosa in curved black arrow and also mucosal folds in single blue arrow. Intraepithelial lymphocytes are present similar to other tonsils. On your left is unlike other tonsils, the mucosa of the pharyngeal tonsil is a ciliated, pseudostratified columnar epithelium with scattered goblet cells pointed in black single arrow, identical to a respiratory type epithelium. Note areas of intraepithelial lymphocytes and plasma cells in bold black arrow. On your right, at the deeper aspects of your mucosal folds, the epithelium contains more intraepithelial lymphocytes and plasma cells, resulting in a characteristic lymphoepithelium in curved blue arrow similar to other tonsils. We move forward with the next organ. This is the ear. It has three regions macroscopically: the external ear, the middle inner ear. In microscopic anatomy, your external ear has an auricle, outer one-third of external auditory canal, inner two-thirds of your external auditory canal, a tympanic membrane. In your middle ear, we have your tympanic cavity, your ossicles, your mastoid ear cells, your IAC, and your inner ear has a semicircular canal, utricle and saccule, an endolymphatic sac organ, and a cochlea. On your left is the external ear, auricular cartilaginous framework in curved black arrow, which is in continuity with the external auditory canal at the concha. The outer one-third is supported by cartilage in single white arrow, and the inner two-thirds is supported by your bone, which is in bold blue arrow. On your right is the outer one-third of the external auditory canal, which is lined by squamous epithelium with numerous associated hair follicles and sebaceous glands in single blue arrow, and also modified apocrine sweat glands in curved black arrow known as your ceruminous glands. On your left is ecutaneous adnexal structures that are numerous in the outer one-third of the canal, but are typically absent in the inner two-thirds, which is lined by epithelium adherent to the bone. Ceruminous gland ducts in curved black arrow may drain to the surface or empty into your pilosebaceous unit as shown here. On your right is ceruminous glands. They are modified apocrine glands, which are characterized by cells with abundant granular eosinophilic cytoplasm, apical snouts in curved blue arrow, apocrine type secretion, and yellow cytoplasmic granules in white single arrow. On your left is the auricular and external auditory canal cartilages that are elastic type cartilages. The cartilage is separated from the cutaneous adnexal structures and ceruminous glands in a bold blue arrow, which is a loose connective tissue, and a single black arrow, and also your thin perichondrium in curved black arrow. On your right is the ear lobule, which is similar to the rest of the auricle. It is lined by squamous epithelium in a bold black arrow with adnexal structures in single blue arrow, and in contrast, there is no cartilage framework which is present here. But the stroma does contain abundant mature adipose tissue in black curved arrow. On your left is a tympanic membrane consisting of a thin connective tissue plate in bold blue arrow, which is lined externally by a squamous epithelium in curved black arrow, which is devoid of adnexal structures, and internally by modified respiratory epithelium, showing pointed in a single black arrow. Your tympanic membrane shows a thickened sclerotic connective tissue stroma due to chronic irritation. On your right is a chronic injury to the tympanic membrane that can result in subepithelial sclerosis in curved blue arrow with secondary dystrophic calcification in a single black arrow known as your tympanosclerosis. On your left is a tympanic cavity in bold blue arrow, which contains three ossicles in curved white arrow, your malleus, your incus, and your stapes, from lateral to medial. This is delimited laterally by your tympanic membrane in single black arrow. The tympanic cavity is in continuity with the internal auditory canal in white single arrow, extending to the lateral nasopharynx. On your right is a tympanic cavity epithelium, typically consists of latent respiratory type epithelium in curved black arrow, lacking underlying glands. Here it is seen adjacent to a paraganglioma in bold blue arrow. On your left, while normally lined with a cuboidal respiratory type epithelium, patches of columnar respiratory epithelium with complete cilia are present in single black arrow to varying degrees, lining your jugulotympanic paraganglioma in bold blue arrow. On your right, your squamous epithelium, which is not present under normal circumstances, is in the middle ear. Its presence indicates a cholesteatoma in a single black arrow, as seen here. These are often associated with chronic inflammation in bold blue arrow and glandular metaplasia in curved blue arrow, indicating chronic otitis. On your left is the ossicles arising from membranous ossification and consist of a compact lamellar bone in bold blue arrow. Islands of persistent cartilage in a single black arrow can be seen at the ends of most of the ossicles. On your right, the ossicles predominantly consist of compact lamellar bone in single black arrow with osteocytes in bold black arrow set with your lacuna, as well as having numbers of Haversian systems. Your islands of cartilage in bold blue arrow can be seen at the periphery of most of the ossicles. On your left is a section from a stapes bone demonstrating a compact lamellar bone in bold blue arrow. Tympanic cavity epithelium in single black arrow typically lines the periosteal surface of the ossicles. The epithelium is identical to the tympanic cavity epithelium, except that the presence of cilia is uncommon. On your right is the mastoid air cells, consists of air-filled cystic spaces in curved black arrow within the dense compact lamellar temporal bone in bold black arrow. Your lining is identical to the tympanic cavity and is tightly adherent to the bone in single blue arrow. On your left is the internal auditory canal, which is lined by respiratory type epithelium in single black arrow. It is present within the bone proximally, but a hyaline cartilage tube in bold black arrow supports it distally. Submucosal seromucous glands in curved blue arrow are present in the distal 2/3 of your cartilaginous portion. On your right, the internal auditory canal is lined by the respiratory type epithelium, but goblet cells in a single black arrow and seromucous glands in curved blue arrow can be seen also, primarily in the distal 2/3. Lymphoid aggregates such as your tubal tonsils may be seen as well. On your left is while not typically seen as a surgical specimen, a portion of the endolymphatic sac can be seen in tumor resection specimens. These appear as epithelial-lined cystic spaces in a single black arrow embedded within your loose connective tissue in bold blue arrow or your bone. On your right is your endolymphatic sac, which is lined by a flat cuboidal to columnar epithelium, and they may have small papilla in single blue arrow. The cells have a small central nuclei and clear to pale eosinophilic cytoplasm in curved black arrow and rest on a loose vascular connective tissue stroma. Now we move forward with your nose and your paranasal sinuses. Your nose macroscopically has nasal cavities, and a pair of nasal cavities extend anteriorly from your nares or the nostrils and posteriorly to choana and separated by your nasal septum. They consist of three distinct regions: your vestibule, your respiratory, and your olfactory. A vestibule communicates the external environment and contains hairs that act as a coarse filter. The respiratory region is the most voluminous portion of your nasal cavity. Your olfactory region occupies majority of the roof of nose and extends medially onto your superior nasal septum and laterally onto the superior portion of your superior turbinate. This is, on your left, is a coronal computed tomography scan which illustrates the nasal cavity with inferior in white single arrow and middle turbinates in curved blue arrow and paranasal sinuses in bold blue arrow, which is included here the cribriform plate, which is in curved white arrow that forms the roof and the floor. In black bold arrow sits on the hard palate. On your right is the nasal vestibule in a single white arrow, communicating with the environment and coarse. It has coarse hairs. The lateral nasal wall contains superior in a bold white arrow, the middle a curved white arrow, and inferior the single blue arrow turbinates. A turbinate on your left is a cross-section of the middle turbinate showing the delicate curved bone core that is in bold black arrow surrounded by your thick lamina propria in curved blue arrow, which is rich in variably sized vessels and covered by your Schneiderian mucosa in single black arrow. On your right is the lamina propria of the nasal mucosa, especially the turbinates and inferior septum. It contains a network of variably sized venous sinuses which has a thick muscular wall that is pointed in black single arrow. These sinuses can rapidly constrict or dilate in response to various stimuli and histologically resemble erectile tissue. On your left is similar to the rest of the respiratory region. The turbinates are lined by your ciliated pseudostratified columnar epithelium in single black arrow with your scattered mucus or goblet cells. Varying numbers of seromucous glands in curved blue arrow are present in the lamina propria and drain directly to the surface via your small ducts. On your right is of regional differences in turbinate histology. The most distal region, which directly confronts inhaled air, is relatively rich in mucous cells in a single black arrow and salivary glands in curved blue arrow. On your left is the turbinate stalk that has a thinner lamina propria with fewer vessels in curved blue arrow and salivary glands in single black arrow. The epithelium has fewer mucous cells as well. On your right is the turbinate bone, which is composed of a thin trabecula of mature lamellar bone in bold black arrow. And similar to the lamina propria, there are numerous muscular veins in single black arrow, dilated vessels in curved black arrow, and arteries in single blue arrow that may mimic vascular neoplasms or malformations. Although there may be adipose tissue in curved blue arrow, no hematopoietic elements are present. On your left is the nasal vestibule, which is lined by skin with stratified squamous epithelium in single black arrow. It contains all the layers of the normal epidermis. There are numerous hairs in a bold blue arrow with associated sebaceous glands in curved black arrow. The coarse hairs and secretions act to trap your inhaled particulate matter. On your right is the transition from vestibule to respiratory mucosa, which is gradual with thinning of the epidermis, pointed in the bold black arrow. Loss of your pilosebaceous units and increased venous vasculature in curved black arrow, with occasional salivary glands and ducts in single blue arrow. We have your respiratory region on your left, and similar to the turbinates, the remainder of the respiratory portion of the nasal cavity is lined by ciliated pseudostratified columnar epithelium in single black arrow with numerous seromucous minor salivary glands in curved black arrow. The lamina propria also contains numerous venous sinuses in bold blue arrow that warm your inhaled air. On your right is your mucous glands in single blue arrow, which drains to the surface via small excretory ducts in bold black arrow. Your Schneiderian epithelium is pseudostratified and columnar. It contains cilia and scattered mucus or the goblet cells in curved blue arrow. Next is your nasal septum on your left. It consists of a plate of hyaline cartilage associated with four smaller bony plates in single blue arrow, fused with fibrous sutures in a bold black arrow. On your right is the olfactory mucosa, which is a modified, ciliated, pseudostratified columnar mucosa in curved black arrow with specialized intraepithelial olfactory nerve cells. These neurons fuse to form olfactory nerve bundles in curved blue arrow in the lamina propria. Specialized olfactory glands or Bowman glands in a single white arrow are also present in the lamina propria and are unique to olfactory mucosa. On your left is an olfactory epithelium that contains bipolar olfactory nerve cells with your nuclei in bold white arrow. Stratified between the more uniform superficial nuclei of your ciliated columnar supporting sustentacular cells in curved white arrow and the progenitor basal cells in a blue single arrow shown here. No mucous cells are present in the olfactory mucosa. On your right is the olfactory glands in a single white arrow, which are unique to the olfactory region. They are tubulovilous serous glands that may have lipofuscin pigment in the cytoplasm. They drain into a small central duct in curved blue arrow. On your left is an olfactory glands in a single blue arrow that drains secretions directly to the surface via the short ducts in bold white arrow. These secretions are thought to trap and dissolve odoriferous substances, allowing new substances to be recognized. On your right is the paranasal sinuses that are air-filled spaces in the bones adjacent to the nasal cavity and are named after the bones in which they are situated. They communicate with the nose via the small openings or the ostia as follows. Your blue is first sphenoid, the pink and green are ethmoid, the aqua, the frontal, and the purple are the maxillary. On your left is the paranasal sinuses, which are lined with ciliated pseudostratified Schneiderian mucosa with mucous cells in curved black arrow. This is in continuity with the nasal mucosa via the ostia. The mucosa is thinner and attaches to the periosteum in bold blue arrow of the various sinus bones in single black arrow. On your right is the contrast to nasal mucosa, the seromucous glands in curved blue arrow, which are less numerous and more randomly distributed. These drain to the surface via small ducts in bold black arrow. Also, the stroma does not contain a prominent vascular component. We move forward with your minor salivary glands. Macroscopically, they are 500 to 1,000 lobules of the minor salivary glands. These arise outside of your parotid, submandibular, and sublingual glands, like the major salivary glands. The sites are found in your buccal mucosa, your lips, the floor of your mouth, the tonsillar pillars, your glossopalatine arches, your hard and soft palate, your uvula, your tongue, the nasal and the paranasal regions. We have three types microscopically: your mucus, your serous, and your mixed seromucinous. We have also important microscopic parts: your acinus, your mucous cells, we have your serous cells, your myoepithelial cells, your ducts such as your intercalated ducts, striated ducts, and excretory ducts. On your left is a low power view of the seromucous minor salivary glands in single black arrow, showing the unencapsulated relationship with the glands having with the surrounding tissue. These glands from the buccal mucosa are intimately associated with the nearby connective and adipose tissue. Small excretory in bold blue arrow ducts are seen between the lobules. On your right is a high-power view of a seromucous gland showing the distinct mucous cells in a bold blue arrow filled with basophilic mucin and associated serous granular demilunes in single black arrow. On your left is a medium power HNE of a seromucous minor salivary gland showing several seromucous units with mucus acini in bold blue black arrow. It is capped by serous demilunes in curved blue arrow. Secretions are collected from the secretory units by ducts. Note also the striated duct in bold black, blue arrow lined by columnar cells with round uniform nuclei. On your right is a low power HNE showing the von Abner minor salivary glands. These glands are found in association with the circumvallate papilla found on the posterior dorsal tongue. Now, on your left is an HNE of the serous von Abner glands in bold blue arrow. It shows the close association to the surrounding skeletal muscle in single white arrow. When minor salivary glands develop neoplasms, this intimate association can make determining invasion difficult. On your right is a HNE showing your serous acini in single black arrow with an adjacent excretory duct in bold blue arrow, usually shorter than those in your major glands. This type of duct is lined by pseudostratified columnar epithelium surrounded by your surrounding fibrous connective tissue. On your left is a high-power view showing your blanded and non-glands. This type of gland consists entirely of mucus acini with each acinus surrounded by your thin connective tissue septa. On your right is a high-power H&E showing the mucus acinus in single black arrow adjacent to an intercalated duct in bold black arrow. The small size of this type of duct makes them very inconspicuous in routine H&E slides. Intercalated ducts are lined by cuboidal eosinophilic cells with centrally placed nuclei. With the major salivary glands, these are the paired, parotid, submandibular, and sublingual glands. The parotid glands are the largest, around 15 to 30 grams. The submandibular or submaxillary glands are approximately 10 grams. Your sublingual glands, it's around 2 to 4 grams. Microscopically, the functional unit is consisting of an acinus and draining duct system. Your acini can be serous, your mucus, or mixed. Parotid is purely serous. Submandibular is mixed with serous predominance. Sublingual is mixed with mucus predominance. On your left is the branches of the facial nerve, pointed in black single arrow, artificially, which divides the quadrangular superficial parotid lobe from the deep lobe. The main duct in curved blue arrow drains into the oral cavity opposite the second maxillary molar. On your right is the deep parotid lobe in bold black arrow, which is wedge-shaped and extends into the parapharyngeal space. Note also the intraparotid lymph nodes in curved black arrow and the facial nerve branching in a single blue arrow separating the deep lobe from the superficial lobe. On your left is the submandibular glands in curved white arrow sitting below the myohyaloid muscles in single blue arrow. A small portion extends above the muscle, and the main duct in single black arrow extends medially to drain into the oral cavity at the sublingual caruncle. The sublingual gland in bold black arrow is above the muscle, and its main duct drains into the submandibular duct. On your right is fibrous septa in curved black arrow. It extends from the capsule to divide the parotid into the indistinct lobules. This parotid from an older individual contains abundant adipose tissue in single blue arrow. On your left is an intercalated duct in a single blue arrow. They receive secretions from acini and are easily recognizable in parotid glands. They deliver secretions to your intralobular striated ducts in bold blue arrow. They drain to progressively larger intralobar in curved black arrow and interlobar excretory ducts. On your right is the serous acini in curved white arrow, which are spherical and drain into your intercalated ducts in single black arrow. The secretory cells are pyramidal with basal nuclei in curved white arrow, and your cytoplasm containing numerous cores, basophilic secretory, the zymogen granules pointed in single blue arrow. On your left is an intercalated duct in curved black arrow, which are lined by simple cuboidal epithelium with pale cytoplasm. Some intercalated duct cells may contain residual zymogen granules in curved blue arrow. On your right is striated ducts, which are simple columnar intralobular ducts that consist of cells with abundant eosinophilic cytoplasm and round central nuclei. Invaginations of the of the basal cell membrane in single black arrow account for the striation seen in histologic sections. These cells have numerous mitochondria, which cause the cytoplasmic eosinophilia. On your left are the contractile myoepithelial cells, which are difficult to discern on H&E but can be appreciated using immunohistochemistry using calponin. They are located around the acini in single blue arrow and intercalated ducts in a black curved arrow and focally in some proximal striated ducts in black bold arrow. On your right is the late embryonic encapsulation, accounting for the 5 to 20 intraparotid lymph nodes that represent the first echelon drainage for malignancies of the face, your scalp, and your ear. They often contain salivary gland inclusions in single blue arrow, which may mimic metastasis. On your left is similar to your intraparotid lymph nodes. Your periparotid lymph nodes also may contain salivary gland inclusions in bold blue arrow, likely due to late embryologic encapsulation as well. These may mimic metastatic disease and can be a source of extraparotid salivary gland neoplasms. On your right is a focal area of atrophy in curved black arrow and are common in excised parotid glands in bold black arrow. These result from excretory duct obstruction and may mimic neoplasms. Acini are lost and only ducts with periductal fibrosis in single blue arrow persist. On your left is the main parotid ducts in curved black arrow traverse connective tissue and muscle to reach their termination in the buccal mucosa. They are lined by pseudostratified or stratified columnar epithelium and may contain goblet cells in single black arrow and cilia. Accessory parotid tissue in a bold blue arrow can be seen in 20 to 50% of the population. On your right is a focal sebaceous cells in a single blue arrow or lobules that are not uncommon in parotid gland duct epithelium in curved black arrow. They can be seen in the majority of parotid glands with careful examination. On your left is your oncocytes in curved black arrow, which are metaplastic cells with granular eosinophilic cytoplasm containing numerous irregular mitochondria. They are often seen in the parotid glands of those greater than 50 years of age but are less common in submandibular glands. They resemble striated duct cells in a single blue arrow superficially. On your right is a lobulation in single white arrow, which is more pronounced in submandibular glands. And there is less intraparenchymal adipose tissue in curved blue arrow than in parotid glands. A central intralobular excretory duct in a bold black arrow is present. On your left is a submandibular gland, which is a mixed gland predominantly composed of your serous acini in single blue arrow, but also containing a minor mucus acinar component. Striated ducts in a curved white arrow are longest in the submandibular gland and are easily recognizable. Intercalated ducts in a single black arrow are shorter than in the parotid gland, but are easily seen. On your right is your serous demilunes, consist of a tubular mucus acini in single black arrow capped by a crescent-shaped collection of serous cells in single blue arrow. These have been shown to be an artifact of fixation. On your left is a sublingual gland, which is arranged into lobules, pointed in single black arrow, but it lacks adipose tissue, unlike other major salivary glands. Intralobular excretory ducts in curved blue arrow empty into large interlobular ducts in a bold black arrow, which are lined by a pseudostratified columnar epithelium. On your right is a sublingual gland, which is mixed with a predominance of tubular mucus acini in single black arrow, many of which are capped by serous acini in bold black arrow. They have very short intercalated ducts in bold blue arrow that are communicating with short striated ducts in curved white arrow. Your pharynx. Macroscopically, we have three functionally and anatomically distinct subsites: your nasopharynx, oropharynx, and the hypopharynx. In your microscopic anatomy, your nasopharynx is lined by both ciliated respiratory type epithelium and stratified squamous epithelium. Your oropharynx is lined by a stratified squamous epithelium. Your hypopharynx are lined by stratified squamous epithelium and no muscularis mucosa in any of the subsites. This is the diagram of the nasopharynx extending from the choana in single blue arrow to the superior soft palate in single black arrow. The oropharynx extends from the superior soft palate to the valleculae in bold white arrow. The hypopharynx extends from the valleculae to the inferior cricoid cartilage in curved blue arrow and includes the pyriform sinuses in curved black arrow. On your left is the nasopharynx, which is lined by both ciliated respiratory type epithelium and stratified squamous epithelium. The pharyngeal tonsil roof and anterior regions are lined by respiratory type epithelium in bold black arrow. Numerous submucosal mixed seromucous minor salivary glands are present in curved blue arrow. On your right is the scattered submucosal, your non-tonsillar lymphoid aggregates in a curved blue arrow are present throughout your nasopharynx. The overlying mucosa consists of a stratified squamous epithelium in bold black arrow alternating with the respiratory type epithelium in single black arrow. Your oropharyngeal mucosa. On your left is the oropharynx, which is lined purely by non-keratinizing stratified squamous epithelium in bold black arrow. Scattered submucosal lymphoid aggregates in a bold blue arrow are present throughout the oropharynx. On your right is the uvula, which is lined by stratified squamous epithelium in curved black arrow and contains numerous mucosalivary gland lobules in single black arrow with ducts in single blue arrow, which has a thin bundle of skeletal muscle in bold blue arrow, which are present in the uvula stroma. On your left is similar to the oropharynx. The hypopharynx is lined by entirely non-keratinizing stratified squamous epithelium in bold black arrow. Scattered predominantly mucous minor salivary gland lobules are present in the submucosa with ducts in single blue arrow. Draining to the surface, your pharyngeal constrictor skeletal muscle in a single black arrow is present below your submucosa. On your right is, although the surface typically consists of a non-keratinizing squamous mucosa in a single blue arrow, exposure to irritants such as your tobacco smoke, can result in surface keratosis. Your larynx. It extends from the epiglottic tip superiorly to inferior border of your cricoid cartilage inferiorly. It is composed of cartilaginous framework supported by your ligaments as well as your intrinsic and extrinsic muscle. It is covered by mucosa. It is composed of three regions: your supraglottis, your glottis, and your subglottis. We have also your anterior commissure tendon or the Broyles ligament, your preepiglottic spaces, your paraglottic spaces, and microscopically they are lined by both ciliated columnar epithelium with mucous cells and non-keratinized stratified squamous epithelium. On your left is a glottis containing the true vocal cords in single black arrow, which are just below the ventricles in bold black arrow. The supraglottis is also composed of epiglottis in curved black arrow, false vocal cords in single blue arrow, and aryepiglottic folds in curved blue arrow. On your right is the vocal cord ligaments in single blue arrow, as well as their attachment at the anterior commissure in single black arrow. These can be seen in this graphic. The paraglottic spaces in curved black arrow is between the thyroid cartilage and your vocal cords. On your left is the main laryngeal cartilage, which are the epiglottic, thyroid, and cricoid cartilages. The thyroid cartilage is broad anteriorly but does not form a complete ring. There are superior and inferior horns in single white arrow and a notch just above the laryngeal prominence pointed in single blue arrow, also known as your Adam's apple. The cricoid cartilage in a bold black arrow forms a complete ring, being narrower anteriorly. On your right, the epiglottis has small holes or defenestrations in single black arrow, and the arytenoids in curved blue arrow sit on the posterior cricoid cartilage in bold black arrow. On your left is the epiglottis in adults, which is typically lined by stratified squamous epithelium in single black arrow, but patches of ciliated columnar epithelium may be present as well. Numerous submucosal seromucous glands in curved blue arrow are present in the supraglottic larynx and typically are situated near the epiglottic cartilage in bold black arrow. On your right is the epiglottis, which is an elastic cartilage in curved blue arrow and has fenestrations in single black arrow, which usually contains seromucous glands and may serve as a conduit for carcinomas to enter the preepiglottic spaces. On your left is the aryepiglottic folds that are part of a supraglottic larynx and extending from the epiglottis to the arytenoid cartilages. They are usually lined by stratified squamous epithelium without keratinization and have less numerous minor salivary glands in the subepithelial stroma. They represent one of the mucosal margins in laryngectomy specimens. On your right is the arytenoid cartilages, which are small hyaline cartilage associated with mucoserous glands in single black arrow and are important in phonation. On your left is a true vocal cord in bold black arrow with vocalis ligament in blue bold arrow, which is lined by your squamous epithelium and is devoid of mucoserous glands. The false vocal cord in single black arrow is lined by squamous or respiratory epithelium and has mucoserous glands in single blue arrow. The ventricle is lined by the respiratory epithelium and also contains mucoserous glands. On your right is the anterior portion of the ventricle in bold black arrow, which contains a saccule in curved black arrow, a segment that extends caudally and can be result in cystic dilatation if obstructed. On your left is the vocalis muscle in bold blue arrow consists of a band of connective tissue rich in elastic fibers and often can be seen adjacent to the vocal ligament in single black arrow. On your right is the conjoined metaplasia and a bold black arrow of the larynx, which is not uncommon and usually occurs in the posterior two-thirds of the vocal cord ligament in single blue arrow. In contrast to true cartilage, the periphery is not sharply demarcated and elastic fibers can be seen extending into the metaplastic focus. Conjoined metaplasia can be seen in other parts of the larynx as well. On your left is a lymphoid aggregate in a bold blue arrow that can be seen in the larynx but are uncommon. When present, they are typically seen in the supraglottic larynx. On your right is the laryngeal saccules. They represent caudal extensions of the ventricles and are normal. They are lined by the respiratory epithelium in a bold black arrow and contain numerous mucoserous glands in curved blue arrow. They drain to the mucosal surface via the small ducts in single black arrow. Both the saccule and the ducts can become obstructed, leading to saccular and ductal cysts, respectively. On your left is saccular cysts. They represent the cystic dilation of your laryngeal saccule. They represent in the supraglottis and histologically are the respiratory epithelium lined cysts. In curved blue arrow, they contain mucin in single black arrow. They usually result from obstruction by invasive squamous cell carcinomas. On your right is, in contrast to the epiglottis, most of the other laryngeal cartilages are composed of hyaline cartilage in single blue arrow with an adjacent perichondrium in curved black arrow. The paraglottic space in bold black arrow can be seen to this thyroid cartilage. And lastly, the thyroid on your left and cricoid cartilages are of the most adult larynges undergo extensive ossification by adulthood, pointed in black single arrow. This is an important oncologic point as non-ossified cartilage is typically an excellent barrier to invasion by carcinomas. Once ossified, it is easier for carcinomas to breach the laryngeal cartilages and subsequently spread beyond the larynx. On your right is the subglottis, is lined with the respiratory mucosa in single blue arrow with mucoserous glands that drain to the surface via the small ducts in bold blue arrow. Thank you so much for watching. And up next is your tubular gut peritoneum in your medical histology laboratory. Don't forget to like and subscribe to my YouTube channel. Have a nice day, everyone.